Hey everyone, good evening. This is Steve Pomeranz, and hope everyone is doing well. And so, one thing that want to kind of explain again is the change of prescriptions. And so, prescriptions have always had the same rules since at least 2006. And so, the prescriptions are now changing with the donut hole, and it's also called the coverage gap is going away. So, for example, this year, the max out of pocket has been $8,000. And there's been different levels. And as you go through the levels, the cost of prescriptions have gone up. And so that's always been the rules are similar since 2006. Now, for the first time ever in the history of Medicare, the drug rules are changing for the max out of pocket to be $2,000. Now that's great, as for a lot of people I help, that's really good. People are used to paying thousands of dollars, and that's really good. However, for a lot of people, it's going to be changes and not always so good. So, for example, uh, in the different states, some of the plans are going away for Medicare Advantage plans. Some of the plans on the prescription coverage are going away. And also, we're still seeing Medicare supplement plans still increasing ever before. And then we do expect that to be the same going into 2025. And so, an example for the drug plan. So, you have a maximum of $2,000. Okay. And the standard plan you're going to have is $2,000 minus a drug deductible, and then your rest of your copays. So, for example, you have a max of $2,000 coming here for 2025 for your prescriptions. Okay. And in January, you have a $590, which is the standard drug deductible coming here in 2025. Okay. So you have a drug, let's say, is $500, for example, and it's a tier 3. So that tier 3 on that formula that the prescription plans use to determine your cost of your prescription is 25%. Okay. So you have $500 times 25% plus your $590 deductible, and that will be your January payment. Okay. So the good thing is that payment goes towards your max out of pocket. So that $590 included in your drug deductible is included. So in that max as well. So you're not necessarily going to be paying $2,000 in a lot of cases because of your drug deductible being subtracted from it. So in some plans, they're not going to have a drug deductible or a lower deductible. And instead of having a percentage, they're going to have a copay. Now, in Medicare language, it is called enhanced plan. Okay. But that's not important. So what is important is that in that case, if there's no drug deductible, the insurance company pays that drug deductible. So instead of $2,000, your max out of pocket is going to begin at $1,410. And in those case scenarios, you'll be paying less on your prescriptions overall for those who have a lot of prescriptions. And on those formula plans, instead of percentages, a lot of them are going to be still copays. So for example, in January, if a plan does not have a deductible or a lower deductible, so let's say, for example, it does not have one at all. So you start at $1,410 in January as your max. And so you go on a prescription, and let's say it is a tier 3 on that drug formula. So it's $47, for example, times 3 for 90 days. And that gets taken away from your $1,410 for that one prescription. So there's going to be pluses and minuses. It all depends on the prescriptions, of course. It'll depend on whether you are want to go on mail order. It'll also depend on the type of prescription as well. Now we're not can't guarantee is that we're hearing a lot of some of these patient assistance programs not paying anymore. So in that case scenario, we'll want to find other ways, or if you want to hit your max out of pocket of your $2,000, or if it's 1,410 faster, then you might hit it in January, and after that, everything's going to be zero. Now, what's also complicating is if you have $600 or more, or up to $2,000 that you're going to be spending on your prescription plan or prescription drugs, you have the option to go on a payment plan. Now, the payment plan is going to be doing it through your insurance company. In order to set it up, you call the insurance customer service. And so that's going to be tough because a lot of times these customer service insurance companies are going to be on hold for a very long time. And so what's going to happen is when you get set up, for example, if you usually get your prescription through, let's say, a pharmacy, CVS, Walgreens, one of those type of pharmacies, then you pick up your prescription, but you still pay it through that payment plan that you're on. So it's going to be things that I'll be discussing with everybody that I help for those who I see and will be hitting that max out of pocket, whether it's $1,410 or $2,000 within the year, that you have an option whether to go on that payment plan or just pay through the when you go pick up your prescription as well. So that's going to be something that we're going to compare both the good and bad. So we're also seeing Medicare Advantage plans. A lot of them, their copays are going up. Not necessarily the premium on most of the plans, but we are seeing some go up. Specials going up, hospitals, ambulances, surgeries, so forth and so on are going up on the Medicare Advantage side. Some of our Medicare Advantage plans have gone away. So we will be talking about that as well when we meet. So there's a lot of changes, scary changes. It's very scary. And I help every single person because I care deeply for every single person I help. And also I bring the experience of being a cancer survivor. So I have taken ambulances and I've gotten a lot of bills. I know how to go around those. Also with my dad growing up in the medical world, being a doctor, medical director of hospitals, medical director of insurance companies, consultant insurance company, and he also created a Medicare plan as well. So I love bringing my experience to every single person I help because it can get very, very crazy for a lot of people, unfortunately, and complicating, especially going into 2025 with all these new. So feel free to take this video, of course, watch it, but also spread the word on social media. Feel free to like it and also keep watching for more. So God bless.